Good evening, everyone. I'm Riley King, and welcome to this evening news report right here on the Riley King Network. Let's begin. Biden takes Trump to task over lagging pace of vaccinations. He said at the current rate, it will take years to vaccinate all Americans. President-elect Joe Biden on Tuesday sharply criticized the Trump administration over the pace of vaccinations for COVID-19. As a prominent public health expert raised questions about the speed by which the federal government was getting shots into Americans' arms. In remarks in Delaware Tuesday afternoon, Biden accused the ongoing administration for falling short of what's needed and what was promised, saying at the current rate it would take years, not months, for all Americans to get vaccinated. Biden ruffled his goal of administering 100 million shots in the first 100 days of his administration, saying the current vaccination effort would need to be stepped up 5 to 6 times to reach his goal of 1 million shots a day. But while Biden's transition is working on plans to increase the number of vaccinations, the president-elect cautioned that the public should be prepared for the momentum challenge ahead. While millions of doses have been administered across the country and the distribution process was still in near stage, President Donald Trump's overpromising in an election year raised expectations that the government and pharmaceutical companies could not meet. Dr. Anthony Fauci, the federal government's top infectious disease expert, said in an interview with CNN Tuesday that we are below where we want to be. We certainly are not at the number that we wanted to be at by the end of December, Fauci, the director of National Institute of Allergy and Infectious Disease, said. Trump said in October that we're on track to deliver at least 100 million doses of the vaccine this year. But in November, Pfizer, which makes one of 2 vaccines, have received emergency authorization from the federal government, drastically adjusted its production and the administration began promising 40 million doses by the end of the year. Since Pfizer's vaccine requires 2 doses per person, that would be enough for 20 million Americans to get vaccinated. But with just a few days left in 2020, it appears the United States will fall far short, or even that. As of Tuesday morning, only 11.5 million doses have been distributed, and officials said they don't expect to hit the 20 million mark until the first week of January. Also, while Azar suggests that would be enough for 20 million people to be vaccinated, it's not clear how many people will have actually received the shots. According to the Centers for Disease Control and Prevention, about 2.1 million people have been recorded at receiving a dose, but that number isn't a good indication of real-time injections, as it's up to states and local authorities to report data and are given several days to do so. Overall, the final numbers are a far cry of what Trump and his top aides promised earlier in the year, such as when Monticello, the chief scientific advisor to the federal government's vaccine program, said in May he was confident that we will be able to deliver a few 100 million doses of the vaccine by the end of 2020. Federal officials remained hopeful and the pace would pick up. Fauci said he thought that as we get into January, we are going to see an increase in the momentum that he said he hoped allows us to catch up the projected pace that we had spoken about a month or two ago. For months, the Trump administration has touted the support it has provided pharmaceutical companies with producing and distributing COVID-19 vaccines, helping lead to more than one receiving authorization for emergency use in record time. But while its vaccine program called Operation Warp Speed has focused on getting millions of doses from the manufacturing to hospitals across the country, the federal government has largely left the final step to overstretch state health departments. Experts have raised questions about whether it has done enough to help hospitals and pharmacy workers through logistic challenges. Giro notes that all public health operators through state and local communities, for example, he said the U.S. rolls out flu vaccine every year in much the same way. It would be a dramatic departure if the federal government decided who gets the vaccinations and where in the states. Administration officials say their role has been to provide money and supplies and support. Indeed, the federal government has left decisions about who actually can receive up to state and regional officials, with the CDC making non-binding recommendations. So far, though, healthcare workers have generally been prioritized across the country in line with those guidelines. The Trump administration's approach to the vaccine distribution to some degree is mirrored its approach to testing for COVID-19, which it also lifts largely up to the states to administer. As a result, a confused, hyper-sized testing regimen across the country left massive gaps in public health officials' understanding of the virus spread, crippling the country's response to the pandemic. It was not immediately clear whether the vaccine rollout would follow a similar pace, with GRO and other officials insisting that the vaccination will ramp up dramatically in the coming weeks. Meanwhile, Vice President-elect Kamala Harris and her husband Doug got the first dose of the COVID-19 vaccine on Tuesday morning. Biden received his first dose last week, while outgoing Vice President Mike Pence and his wife got theirs the week before. And that does it for this evening news report right here on the Riley King Network. Thank you for watching. Have a great rest of your evening, and see you back here tomorrow for another news report. Good night and goodbye, everyone.